Good morning, everyone. Welcome to our COVID-19 weekly media briefing. I'm Carrie Schutte, the Public Information Officer for the Shasta County Health and Human Services Agency. I apologize for us being a few minutes late today. We had some technical difficulties, but here we are now. As of February 15th, we've had a total of 10,810 confirmed cases, including 92 from actually a 5-day period from Thursday through Monday. Our highest number was 35 on Thursday, and our lowest was 9 on Monday, which is a nice drop for us, a welcome relief. We've got 14 people hospitalized in Shasta County, including 2 in the intensive care unit. We have an estimated 156 active cases and 10,483 who have been released from isolation to date. We have had 171 Shasta County residents who have died from COVID, and we've done just short of 150,000 total tests. I wanted to quickly issue a reminder that we will have our second of 2 town hall meetings online in this virtual format next Wednesday after our media briefing next week on February 24th. Our regular weekly online media briefing will take place from 11 to 11:30, followed by questions from the public from 11:30 to 12:30 p.m. If you would like to participate, please send your question via email to covid19@co.shasta.ca.us. That information will be in today's daily incident update. So if you want to grab that email address from that, it should be available after about 4:30 today. With the subject line, question for town hall meeting. We get a lot of email into that inbox, and that will help us make sure that we do not miss your question if it has that subject line in it. We will read the emailed questions aloud in the order that they were received for response from our health officials. Please make sure that your questions do address local issues and not those things that the FDA or the State Department of Public Health or other agencies would be better equipped to address. If you have more than one question, that's fine. We would like to go through, make sure that everybody has an opportunity to ask at least one question, and as time allows, we will ask any additional questions that might come up. And I also wanted to share that we will be having a second dose clinic for Moderna. If you received your first dose on or before January 26th and have not had your second dose, we're having a clinic on Saturday, February 20th. That's this Saturday at Shasta College from 10 a.m. to 4 p.m. Please bring your CDC card, your ID, and the paperwork that you can find on our website. It's a walk-up clinic. You'll park and then walk into the Shasta College gym. We will have some assistance available for those who have a little bit of a more difficult time walking, and we will look forward to seeing all those folks then. Those are all my tidbits of news to catch you all up on. So we will start with our Public Health Director, Robin Schurig.
All right, thank you. Good morning. I have similar news to a couple of weeks ago. While our case rate is still in the purple tier, both our test positivity and our equity metric are in the orange tier. So once again, because both of those measures are 2 tiers below our case rate, we could qualify to move to the red tier in 2 weeks if those measures stay in the orange and if our case rate continues to decrease, even if it is still in the purple. Our case rate is currently 14.8 daily cases per 100,000 population, which is still more than twice the upper limit for the red tier, but it's the lowest it's been in a long time, since October, in fact. So again, this is not the time to let our guard down with regard to COVID safety precautions. Rather, it's time to double our efforts to stay at home as much as possible, and when we do go out, to keep our distance and wear our masks so that we can hopefully move to the red tier this time and hopefully stay out of the purple tier. And that is all I have to share this morning. I'll turn it over to Dr. Ramstrom.
Morning, everybody. So just a quick update on where we are with our vaccine project in the county. So to date, we've received 21,600 doses, and our most recent allocation was 4,250. And as we've shared before, we get those allocations and push them out right away to our vaccine providers. As Carrie mentioned, we have a second dose clinic this coming weekend. Our current focus has really been on our second dose clinics primarily for our older adults. And we're also working on a series of clinics to get our education staff, K through 12, vaccinated. And so that continues to be in the works, and will kind of roll out over the next several weeks to get both first and second doses for that population. So that's kind of our focus right now. That 4,000 doses is a combination of first and second doses, and slightly up from what we'd had in previous weeks. And so we'll see what we're allocated for this week. There's been a little bit of a delay in learning that number based on the weather in the Midwest that's impacted some shipments. So hopefully that'll resolve soon, and we will learn what that allocation is that we'll receive for next week. And I just want to emphasize Robin's point about, it's really, we recognize people are fatigued with this pandemic, but it's so important and so ingrained in our habits now to wear masks and physically distance, and that continues to be so important even with vaccine rolling out. It's not to the degree that it's going to give us community immunity. We're not even close to that. And even as we approach that, we have the risk of these more infectious variants that are becoming more and more prevalent. And so we just need to continue to practice those prevention measures, really limiting the number of people that we're around, wearing our masks and social distancing, to hopefully continue to have those case rates go down and get us into a less restrictive tier, and to prevent a surge as more of those more infectious variants become more common. So that's all I had today, but happy to answer questions.
All right, thank you, Dr. Ramstrom. Our hospital partners with us today include Robert Folden from Mercy Medical Center, Mark Mitchelson from Shasta Regional Medical Center, Dean Germano from Shasta Community Health Center, and Glenn Hayward from the Redding Rancheria. I know that Mark had something to start us out with today.
Thanks, Carrie. So I just want to talk about the vaccine clinics that we have been having at the hospital. We've been very successful with them. I believe as of yesterday, we've done over 4,000 vaccines for the community, which has been great. We expect another 400 tomorrow. But for the clinics next week, we are reserving next week's clinics for people that got their initial Pfizer injection with us a couple weeks ago. All next week will be just the second injection for the Pfizer vaccine. We expect a little over 1,000 individuals needing that vaccine for next week. So we just want to make sure that there's plenty of space there for them at that time. So next week, just individuals getting the second shot. Thank you.
All right, thank you, Mark. And Robert Folden also had something for this morning.
Good morning. Yeah, just a couple things to report on. So one, visitation, we're relooking at our visitation policy and are likely going to open that up this week, allowing one visitor per patient. So we've been working with our infectious disease docs on that process. There's still going to be some restrictions in place. The cafeteria is going to be closed to the general public. Folks need to wear masks. Folks need to be work with our staff, because there are times during patient care where people should not be in the room, but hopefully that will be seen as a positive thing. And then also with the vaccine rollout, we've kind of targeted Fridays as days where we can help with mass vaccination clinics. And we've done 3 so far. We did 2 clinics on the 5th and the 6th, and we did another one last week. So we vaccinated 5,490 individuals just in that effort. And then we're kind of at a point where we are, I'm going to say, wrapping up our effort to vaccinate staff. And we're moving more into a maintenance mode. So as I've shared with many people before, I think a lot of folks were waiting to see how people would react to the second dose of the vaccine. And now that we've sort of got past that hurdle and realized that most do quite well on that second dose, we're seeing many other staff now getting the vaccine. So I had asked the media, let's hold off till about March or April on percentages, but I'm feeling pretty confident right now that we're well above the 50% mark, probably more like in the low 60s at this point. So that's feeling really good. And then lastly, with the large community vaccination efforts, I guess there's a few points I just want to make for people. It's a huge undertaking. So what we're doing at the college takes about 70 to 80 people in order to do one of these events. And we're out there for 12 hours for an 8-hour vaccination day. And the one thing we've kind of started to run into now with the weather back east is that we're concerned with supplies getting to us on time for this Friday, Dr. Ramstrom, kind of like you mentioned. And then just the specific supplies as related to Pfizer. So you've heard us talk about the Pfizer vaccine. If we have the correct needle and syringe, we can actually get a 6th dose out of that vial. And it's our intention to try and use the Pfizer vaccine at these mass vaccination clinics so that we can maximize the use of that vaccine. So we've asked our supply chain folks within Dignity Health if they could divert the sort of specialty needle and syringe to us that allows us to get that 6th dose out of that vial. Otherwise, the vials tend to only produce 5 doses. So I think our outlook looks good from that perspective, since many of the other efforts are using Moderna. So again, we're just trying to be a little strategic for the greater community on how can we get the most vaccine out quickly. And I'll stop there.
All right, thank you, Robert. Dean did not have anything for this morning. Glenn Hayward, do you have anything you'd like to share this morning? I'm not hearing Glenn, so he might be having some audio issues. Okay, so we are ready for media questions.
We have several viewers, and I'm sure you've had a lot more people contact you. I'm not sure who this might be for you, Carrie. I'm not sure. Is there a central location where people can find out about clinics? So many times we're hearing from people saying, "I didn't know this clinic was happening," or what? Is there a spot? What's the best way to find out when these clinics are happening?
That's a great question, Mike. Thank you for that. We have been asking people to go to shastaready.org, click on vaccinations, and click on that blue oval that says, "Tell me when it's my turn." We still do not have adequate supply of vaccine to just open up a clinic to anybody who is wanting to be vaccinated. So we've been reaching out to people from that list, sending out email invitations, and then signing people up 4 times to make sure that the people who come will be vaccinated because we have enough vaccine for them at that time. So we're still not at a place where we're posting, everybody come to this clinic at this time. But we are asking people to sign up on that link so that we can notify them when it's their turn and when we have a vaccine available for them. They can also on that page click on the link that says vaccine options, and you can sign up for other clinics in that way. The Safeway clinics and things of that nature. Some of the other healthcare providers are doing clinics as well, and that's another way to reach out and find a clinic. Right now, as Dr. Ramstrom mentioned, we are focusing on people 65 and older, and then our healthcare workers, our educators, and that group of folks that are in phase 1A still. Karen or Robin, did you have anything to add that I missed?
No, I guess I would just add that we recognize that this is very unsatisfying to people who are trying to figure out where to get vaccinated, and it's very frustrating. And we are equally frustrated with the logistics of getting these kinds of clinics scheduled. We just don't have the infrastructure for it. And so there is some software that's in the works. It's actually called My Turn, as Carrie mentioned. And we are hoping to be able to move in that direction soon. It's a platform that's being used statewide, and we are exploring it and have started implementing it to some degree. But there's a few kinks that we're kind of working through. And so once that's available and we'll be prepared, I think, as vaccine supply increases, to make that available to, again, additional select groups before it's really open to the general population, probably more later in the summer. So, but hopefully that will help people who are eligible to more readily find a location to go as the vaccine supplies increase. So please be patient, and we'll continue to update you on these weekly briefings.
Thank you. A quick question for Robert. Is a patient allowed one visitor per day, and is it just that one visitor, or can it be like other people as long as it's only one visitor in the room at a time?
Yeah, no, Mike, we're going to limit it to one visitor per day. And, you know, as we move through the tiers, we will likely be able to relax that a bit. I don't ever see us going back to what historically has sort of been the case here at Mercy Reading. It feels like we really didn't have a visitation policy. Anybody could come and go as they wanted. And I think just the nature of our work and we will likely never return to just the wide open space. But I think once we get back to a lower tier and we're not worried about COVID, certainly we'll likely get to like 2 or 3 visitors per day for a patient. But I'll remind you, historically, we really didn't have a strong visitation policy. About the only thing we enforced was allowing folks to get rest at night and asking visitation to end around 8. Right now, our visiting hours are 10 to 7, 10 in the morning to 7 at night. And it's an exception, up to this point, it's been an exception-based policy, which has been really difficult for everyone.
Thanks, Robert. How about Mark? Mark, what's the situation at SRMC?
So Robert and I have been in conversation last week, and we're following the same guidelines. We're going to be opening it up to the one visitor, designated visitor at this point. And then kind of slowly, as the weeks go by and we start getting lower and lower the tier, we'll be opening it back up to what our kind of generally normal process was. But similar to Robert, we don't want to go too quickly and then have some sort of contamination, cross-contamination with visitors and patients. We want to make sure people stay safe.
Thank you.
You know what I really look forward to, Mike? I really look forward to the day when we can have our volunteers back. So unsolicited, we've been at this for over a year now, and it's odd not having we have roughly 400 volunteers, and it's just odd not having them here. So I think amongst everything, visitation is always number one. And then the second thing I think about I want my volunteers back. I mean, they just bring a whole different dynamic to the hospital, to our work, and to our patients. So that's what I'm looking forward to.
Other media questions?
Good morning, everyone. This is Anna from Channel 12. I just wanted to touch base again on the vaccine. Dr. Randstrom and Robert, you both mentioned about weather impacting the vaccine supply. Could we see like a really severe delay when it comes to the vaccine supply heading here to Shasta County?
So I'll speak to our experience. Usually on a Monday, we're able to get our tracking number for vaccine material as well as supply material. And because of weather delays, we weren't even able to get our vaccine tracking number until yesterday. We're still working to get our tracker number for the supplies. So I think it's a point in time. It'll probably be this week only, unless we have other severe storms that come through.
And just to follow up on that, for anyone here who's kind of running the clinics and stuff, could you see delays in vaccine supply impacting operations?
So Anna, that's been a concern week to week to week in this effort because we have limited supply. So every single week we are planning based on what we know for that week. And so this is yet another hiccup and one hiccup after another, to be honest with you, with regard to vaccine supply. And so we're hoping it'll free up later this week, as Robert said, and we'll be able to proceed with clinics as planned. But, you know, we've had situations where we've had to just cut back on the numbers we can get to, not as many as we'd hoped for. We're hoping we don't have to cancel any clinics because that's very challenging and disappointing to people. But we're managing, and we can't control the weather, and so we'll see. Hopefully, we'll get our supply as anticipated. But we will adjust our vaccine allocations to best meet the need and to accommodate clinics that are scheduled.
I know I'm not part of the media, but I have a question for our public health folks. With Blue Shield taking over this process with the state of allocations, how do you envision that adding complication to already a complicated situation with us in terms of, whatever it might mean?
Yeah, Dean, so we just received a message from them yesterday. They have an initial call, so we're working on scheduling that, and so we'll learn more when we have a conversation with them about what they can offer and how we would be coordinating our work together. So more to come on that.
Any questions?
Sorry, Anna here. Just wanted to follow up on something else. Robin, you mentioned, it looks like Shasta County again headed in that red tier direction. You know, we've said this before, but the concern now, I guess, would be those Super Bowl numbers. Have we, have we gotten those Super Bowl case numbers back yet that could impact our tier placement?
So we're about a week and a half out from the Super Bowl at this point, and so just based on the numbers of cases that we're seeing coming in each day, it's not looking like we're going to see a surge from that. So hopefully that will not impact our numbers going forward, and hopefully this time we will be able to move into the red tier, but we'll just have to wait and see what the data looks like when it comes out next week.
Alrighty, and then I just wanted to follow up on something too. Can you just exactly explain what is the equity metric? I know that you said it's like kind of one of the requirements that places us in the red tier.
Yeah, so the equity metric is a measure of test positivity among people who live in certain areas of the county that have been deemed more disadvantaged. And it's based on a statewide data system called the Healthy Places Index. And so it uses a variety of different data metrics to determine which areas they consider to be disadvantaged. And so among people living in those areas, it's just a measure of how many tests among that population come back positive.
And there's something else I wanted to ask too. You know, I was reading some articles that it sounds like people who work in the medical marijuana industry or run dispensaries, it sounds like they were placed in phase 1A of the vaccination plan. I was checking Shasta County vaccination rollout tier system. I didn't see that they were on the list exactly, but I know Public Health, CDPH put out a notice, a bulletin that medical marijuana workers can be in phase 1A. Have any of those people, that group, gotten their vaccines, or have you seen that group get their vaccines?
Yeah, Anna, we continue to have clarifications and fine tuning of definitions of who's in each phase. And so that was a group that came up late, and we received that message. I don't know personally about any medical marijuana providers who have requested or sought. I don't know that we would know that. And so they're certainly on the state's list. We haven't updated every single group in phase 1A on our chart on our website. We can do that, but we hadn't really seen a need to do that. We do it periodically as more changes come along, and so we could consider adding them the next time we update that chart.
Perfect, thank you. And then just, because they are placed on like the state's guideline list, so they are eligible here in the county to get their vaccine if they choose to do so.
All phase 1A, yes, are eligible right now. Mm-hmm.
We have an online question from Donnie Chamberlain from a news cafe. She is having difficulty with her audio. She says, Shasta County COVID numbers are down, but we're still in the purple tier because of the high positivity rates. Would it put a strain on the HHSA system or be a waste of resources to have a campaign for mass testing to lower our positivity rates and get the county back into the red tier? And then she clarifies, she means even people who have been isolated and don't have much of a chance of having been exposed. Robin.
Thanks. Yeah, so first of all, just to clarify, excuse me, sorry. The reason that we're in the purple tier right now is actually not because of our positivity rate, it's because of our case rate. Our positivity rate is one of the measures that is down in the orange tier right now. So it's actually just the number of cases that we have per population that is keeping us in the purple tier at the moment. However, as I've said many times before, yes, it's always a good idea for people to go and get tested, especially if either they're experiencing symptoms or have been exposed to someone who's tested positive, but also people who are just out and about, either for their job or for other reasons, and they're around other people regularly. It's a good idea for those people to get tested regularly. So that would certainly help to adjust our case rate down, and it could also help to keep our positivity rate in the orange or lower.
Okay, so Donnie, go ahead and send me just another message if you have a follow-up question for that.
And I just, Carrie, real quick, I might just add too that our LHI sites have capacity. And so, you know, we do encourage people to go online and sign up and go get tested at any of those locations. We have access to testing, ready access to testing in our community right now. So we recommend people take advantage of that, as Robin described.
And those testing sites are also doing walk-ins. There's one at Shasta College, the Boggs Building on Breslauer, and then the Reading Senior Citizens Hall on Benton Drive. And she's saying, Donnie just asked, thank you for the clarification. I'm asking about intentionally testing folks who haven't been exposed, no chance of being positive. Would we recommend that those people be tested?
I think, I mean, it doesn't hurt for somebody to get tested because you never know if you may have been exposed. You know, you may not be aware that you've been exposed, but I would say, you know, if someone is staying at home by themselves 100% of the time, then no, I don't think we would recommend that they go and get tested.
All right, any other media questions? Okay. Thank you, everyone, for being here with us again today. We will be back next Wednesday at 11 a.m. Everyone stay safe and healthy.